Okay, students, guess what? We're into another unit called Beyond the Basics. So the reason why this unit is called that is that this is information that is typically beyond what is taught in an entry-level program, but the demand of entry-level practice sometimes requires the beginning knowledge of this information. So we're looking at adjuncts and, things like how do you use a suction cup, or how do you apply hydrotherapy. Also, most state licenses, when they determine scope of practice, will incorporate things like, strange hair going here. We'll incorporate things like hydrotherapy. Just as a side note, do you realize how much I look at myself when I'm doing these videos? Just pointing that out. Back to what's important. So here, this unit is going to lead in to this content at sufficient depth so that you are able to incorporate these things into entry-level practice in a very basic way, and can also guide you into future study, how you want your professional development to move forward after graduation. We also talk about in this unit adapting massage to specific populations, and that content will be tested on the MBLEX exam. And we look at careers, and you might get some questioning there as well. And then the final really cool chapter is chapter 16 with all those case studies. All right, let's go. There's our book. Oh, glasses. There we go. And there's our unit, Beyond the Basics. Adaptive massage here is the one where we take a look at what do we do specifically for a long-term care or acute care, or what if somebody has been burned, or that's the chapter we get into there. Complementary Bodywork Systems, which is the one we're going to do right now, chapter 12, leads us toward an understanding of how general massage is specifically adapted to target a specific physiological function, and also how we can incorporate adjuncts. So here we go. And there's some really good videos about this, particularly fluid movement, on the YouTube channel, as well as what accompanies this chapter on the Evolve site. So the first thing we have to do is understand the whole complexity in this arena. Is it massage? Is it a unique intervention? Is it an adaptation of massage? Is it in our scope of practice? Is it not in our scope of practice? All of that kind of stuff. And what's the difference? What's the difference between massage and body work? Is body work massage? Is all body work massage? And all of that. I think having a working knowledge of hydrotherapy and which is water, and thermotherapy, lots of times connected, because water transmits temperature, hot to cold. And this use of an implement as a thermotherapy, very safe use of essential oils, and then again, very safe use of implement assisted. This is using a tool. That's really what hot and cold stones are. It's using a tool to augment the hand. And then a section on KT taping. And then we get into this area where some think that the soft tissue application has been so adapted towards a specific function that it is now no longer massage. And I don't agree with that. Obviously, you can hear it in my tone, but I do think that there are situations where the client's condition is so compromised and that they are fragile enough that if we're going to, this targets fluid, if we're going to target that area, that there needs to be additional training, and the soft tissue application of that needs to be part of a more complex treatment plan and not in isolation. So here are those fluid movement protocols. And these are targeted to general health and wellness function and minor intervention processes, not if there's significant pathology. Then we get into our connective tissue approaches and trigger point and all of that. And then we get into our culturally based approaches. And we want to make sure that here we are working respectfully and not involved in cultural appropriation. You cannot learn acupuncture, acupressure, shiatsu, etc., Ayurveda. You cannot learn that in a weekend. This is a discipline of study. Then we also talk about biofield energetic type approaches, and reflexology, foot massage, etc. So lots of things here. The chapter explains it very well. And there are also videos that help translate the words into your physical action. Work really, really good. Okay, objectives, quite a few of them here. And then your key terms, and you will find these terms used on the MBLEX exam. I've already explained that price first aid. There's questions here about the use of ice in the acute injury stage. So there are other acronyms out there for that. And then here's the general classifications. This is what I hope you understand here, is that therapeutic massage adaptation so specific that it's often incorrectly classified as a system of bodywork outside of massage therapy. And you're going to see, for example, lymphatic drain and myofascial release will fall into this. I don't do massage, I do myofascial release. Well, I don't know. Then you've got respect for Eastern and Asian-based methods and other approaches derived from cultural traditions. It is unethical to take a class, 1 or 2 day class, and say that you practice this. This is a 2-year lifetime studying through here. But we can use some of the principles, and we can incorporate some of the methodology to augment massage therapy. Stuff that's not massage by the hands, but influences specific physiology and enhances outcomes. And a lot of times you will find these adjunct approaches in the wellness industry as add-ons. And then a lot of these also will show up in rehabilitation. And then the energetic or extremely light or no touch methods. We'll discuss the evidence surrounding that and how those concepts can be utilized. And then these four are categorized here in the textbook. So we got stimulus response, which is our hydrotherapy, thermotherapy, fluid movement, structural type systems, looking at primarily connective tissue interface, neuromuscular, and these are often in overlapping, but this would be maybe the muscle energy technique, trigger point therapy, etc. And then again, these cultural-based systems and energetic systems. It's confusing. Yep. So here is an explanation of adjunct. And this whole area that is being described here is trying to put all this into context. And then we're going to get into the specifics here, and we're going to try to make some sense of all of this. This quote here that actually has to do with shiatsu, I think puts it together really well. It says some professional therapists insist that a great difference exists amongst the three: ama, Chinese, Western massage, shiatsu, and Japanese form of treatment. But I believe that a great difference cannot exist within a general field, in this case, manually applied stimulation to the body. Of course, there is a variety of methods and schools, but basically they are similar. So then you can read the rest of the quote. So this goes on to explain that this interface with body, mind, spirit, and then the languaging confusion that we struggle with in the massage community to try to frame all of this. So there you go. Hydrotherapy and thermotherapy. Again, procedures and sequences very carefully outlined. And there are a lot of ways that this can be included within the massage setting without necessarily having to have specific hydrotherapy equipment. So here's the history, indications for use. These tables are very helpful. You're not going to be tested on the NBLEX on the specifics, and hydrotherapy, I encourage you to learn more. And your support YouTube videos and materials that will be posted to augment your Zoom classes. There will be additional resources on where you can go to get more information. So always slow down and pay attention to your key points. And then these are the various reflexes that are involved. And then here's heat. And then here's a takeout on this. So here's box 2-1. Then we get down here and we're looking at 2-1, 12-1. And then we've got this box inside here that talks about how massage does not directly affect toxins in the body. And it doesn't. So make sure you work with that and make sure that you are accurately describing what you do. And then we've got how water can be an antispasmodic, and then effects of cold and ice. And then here's your classifications of water. You might encounter a question around that. Usually, what is the range? So 98 to 104. And then the various effects on circulation. So hot and cold affects the nervous system. It's a stimulus. It's an external stimulus. It affects the nervous system, but it also affects circulation as a way of restoring homeostasis. So if something has been made cold, then the body will try to heat it up. So these are the various effects, and this terminology probably will not show up on the MBLEX exam, but for your purposes, it's important to know these various primary and secondary effects. And then the specific effects of hot and cold related to massage, risks and contraindications, some supplies that you will need, and then optional equipment. Hot packs are really easy to use. Hot towels, cold towels. These are easy to incorporate into the massage environment. So the safety part of all this is you need to be careful to not burn somebody, and you need to be careful with the length of time of a cold application so you don't freeze the tissue. So this goes through and gives you some variations on this. You might want to try these at home. Teaching very simple thermotherapy and hydrotherapy methods can be wonderful self-care. All right. That's what this is all about. Right. And then here is the actual integration into massage therapy. And then it's cueing you to see if you can to practice some of these things at home and see what you can come up with. All right. Here are some rules to guide, and then some suggestions for health purposes in through here. And here's that box I mentioned earlier on ice, rice, price, police, meat, MCE, mice, and crime. I don't know what to tell you. On the MBLEX, the current pattern is no ice in the acute phase. All right, now, people aren't actually even using stones anymore. They're using implements that retain heat. So they're fake stones now. So I don't know. I don't know what you'll find with this. But you'll get maybe a basic question about this on the MBLEX exam. I see this as a thermotherapy tool, thermotherapy application, and the potential for it to be used as an implement, like a pressure implement. So this goes through and explains that, and it even gives a little bit of insight into why there is some of this idea around healing qualities of various minerals and stuff. It's interesting. And then it can be a gliding tool. This is as an implement, a pressure point tool, a compression tool, and a thermotherapy tool. And then the thing you have to be careful of when you're doing this is that you're not gripping hard to hold the tool. And you also are cautious if it's really hot that you can comfortably hold it in your hand. And then it gives you some idea about if you go and select river rocks or whatever. And again, there are a lot of artificial stone-like implements now that you can purchase that are easier to clean. They're ceramic and so forth. Don't get gimmicky with this. All right. Then here is your a procedure with safety first. And here at the school, we use the Synergy brand implement. It's a ceramic system that's a variety of shapes. But here's some, these are river rocks. And then you can also use other uh, implements, other tools that have weight and mass to them. And this shows a variety of rice packs. And then careful, careful, careful to not burn. Aromatherapy, this is a chemical process. These chemicals do get into the body. They are not always safe. You want to be careful when you use this there. If you're going to use these therapeutically, then you know, to actually treat conditions and disease and not to augment the environment and general health enhancing, then you need more training. So this section is about what to do generally and safely with essential oils. So it goes through and it gives you some recommendations and talks about the quality. All essential oil use should be diluted into a carrier oil. Essential oils are highly, 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 highly concentrated, and they can burn. They can be caustic to the skin if you're not cautious. So when you dilute them, it's like you're putting it back to its typical dilution instead of that high concentration when you put it into a carrier oil. Here are the benefits, and there is some research on this, and it's talked about a little bit in here, and then pay particular attention to these safety guidelines. Don't take them internally. Here are hazardous oils you should not use. And then the reason why these oils are not recommended for pregnant clients is that they generally are stimulants or they cause a smooth muscle contraction. So this is being very cautious. And then these are also stimulants that you would not use if somebody has a seizure disorder. So here are some applications and the dilution ratio. And people typically use too much of this because they want to smell it. They want to make sure they smell it. And so be careful with that you don't overuse it. And then here are some suggestions. This one is fun on how you would involve the person in making a little blend for themselves. But it starts with giving the person a selection of considered safe oils, and then they sniff and choose the one they love, and then the one they love the next best, and then the one they really hate, and how you can put it all together and develop a blend for them. It's fun. Focus on professionalism. Make sure that you also, if you're using essential oils a lot, don't become overexposed and sensitized. So this table, again, gives you some therapeutic qualities of the individual oils that are generally considered safe most of the time. So based on an outcome, here's well-being, Here's more related to like a physical condition. And this starts to get into where you probably are going to need more. This is using the essential oils to treat a condition. Now they do this a lot in Europe, but not so much here in the United States. Okay, safe, 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 safe. Implement assisted. Again, safety first. So an implement is any device used to augment massage application. And in scope of practice, in the individual licenses, it typically will say a device that augments the use of, the application of the hand. So something that I could do without an implement, the implement would then assist. So then the decision is, does the implement make it easier for me? Not necessarily makes it better for the client, but does the implement make my job easier? And sometimes it does. So here are electrical devices, and these can be, they're usually percussion or vibration based. And I do think these can make life easier, both percussion, uh, this type of action, and vibration. Those are both hard to do, and I think that an external device can make the massage application much easier on the massage therapist. But you also have to make sure that you understand that holding those and the vibration and the secondary effect up into your body can become a problem. So this is talked about here with some justification and contraindications on how to use. And then we've got instrument assisted. This is where you are using some sort of a tool with a little bit of an edge, and you're scraping down, you're pressing down, and you are trying to create a histamine response. And there's also the potential here for tissue injury. So that's where the caution comes in. Now, these approaches have been used for ages in culturally based practices, but that's not what we are doing, right? We're augmenting massage with these. So it's a whole different approach than you might see in a therapeutic use of coining or scraping. So don't confuse the two there. So here's your contraindications, and here's some recommendations of some various tools. I learned to do this with a spoon, and the one I like the most is a butter knife. They may not look as professional as something you might purchase. And then this expert here, she was the one that talked about disposable lids. This would mimic like a coin that was used in some systems. And that's disposable. So here is your procedure. Follow it if you're going to, practice with this. And you can practice this on your own body. All right. Then we've got cupping, suction, vacuum, negative pressure therapy. And I think this is helpful. I would use judicious use of this negative pressure for superficial fascia intervention more than I would rely on the use of more traditional or common myofascial release techniques, because it's easier on me. And you are applying the principles of that, which is a lift and a drag and a translation. So, but again, you need to make sure that you're looking at safety first. And the goal is not to create these red marks. Now, it might be in another system, but not for massage. It's easy on you to use a device like this to lift the tissue and then translate it. Okay. And then here are your various applications. And, you know, if you keep the device, the suction cup moving, you're less likely to have those red marks. And again, this is something that you can teach clients, because these devices are easily found, and they can purchase them themselves, but you would teach them how to do it safely. The next one is KT taping, and you can buy this over the counter, and we will give you an introduction to all of these as part of your hands-on training. And there are a lot of videos, support videos on on YouTube on how to do this. So the advantage of having somebody, so anybody can tape themselves. Anybody can use a scraping tool on themselves. Anybody can use a suction tool on themselves. When we incorporate it into the massage application, we're trying to augment what we're doing, and we're also trying to maybe teach somebody how to do this for themselves. So there are tons of YouTube videos that can do that can be part of that teaching response. And they pretty much are saying the same things. And I don't know. I think there is some benefit. The tape stays on after the massage, so it's an ongoing effect. You got to be careful that the tape brand doesn't irritate the skin. The way it is applied does provide for a little bit of a lift, and it does, provide for a little bit of translation in the superficial fascia skin, deep fascia interface, which is part of a lymphatic move. So it can help with that. It can certainly create a counter irritation. And so superimpose the sensation, as can all the other methods we discussed. And it has a lingering sensation to it. So there are ways, especially this counter irritation, there's some research here where there's value. And then here are your general uses and how to apply the tape. And there's tape that actually is pre-cut for you, and it has little markers inside the tape that can show you how much stress you put into it, and then how to remove it. Okay, that's this part of it. Now we're getting into the adaptive massage targeting this fluid movement. And you want to have a little bit of an idea of what can become dysregulated in the physiology here. And you got to have an idea of normal function. So whatever we're going to do here is going to mimic normal. So we got to know normal first. And then we can look at what could massage application or even an adjunct do to support normal function or mimic normal function. And again, excellent video support for this on Evolve and the school YouTube channel. So here's some of the history. And this box right here, box 12.7, it's going to give you a protocol that incorporates a variety of approaches. and frames those within the most researched approach, which is the osteopathic manipulative techniques and lymphatic pump techniques. So this is the sequence that you can use. And there's also some recommendations here on other video support, as well as what you'll find in your Evolve resources. So here's what I was talking about as an evidence-informed, biologically plausible approach. So you got to know about the lymphatic system. This is going to complement your science studies. You got to know how the fluid is moved. You need to assess, and you need to determine if it's why the fluid retention is there if you're looking to treat a fluid imbalance, general edema, or you can use this just to support health and wellness. But if you're looking at it from more of an intervention for a pathology situation, then you're going to want to pay attention here. And then here are your indications and contraindications. Here is how we're going to alter our general massage approach. There's a change to the depth of pressure, speed and frequency, direction and rhythm and duration and drag. And then how we're going to turn that into a targeted massage approach. And then here is your procedure. And then a similar approach for targeting blood circulation. We got to understand the circulatory system. We have to understand normal function. Then we're going to mimic that function. And, this proficiency exercise gives you an idea of how fluid moves in a tube, which is kind of what we're looking at. And these three approaches combine really nicely together into a fluid movement approach for general health and well-being. So this is where we're headed here. And this is a picture protocol on how you can pull all of these things together. And this is worth practicing. This can be a very nice approach. It tends to have a little bit of, it has a very rhythmic approach. It's not using very aggressive pressure. It's comforting. If somebody's feeling a little tired on a day or something, this might be a way to adapt to it. And I just include these basic principles into every massage I do. And there's nothing unique here. And if I identify that it could be supportive to slow down and modify in that direction just a little bit, I will. Now I've used this approach more locally, a ton on musculoskeletal injuries with all of the athletes I worked with. But really get the idea of this protocol being a full body approach. And here's your picture. And again, you've got some support videos, both on the school YouTube channel and on the Evolve site. All right, now same idea. Now we're modulating this information into a connective tissue approach. You might have heard the term myofascial release, etc. And actually the pressure levels and the drag intensity between myofascial release and lymphatic drain are very similar. The difference is the drag component in your myofascial approaches goes into the bind and just through it and holds it there to support the connective tissue sliding. So you can actually use kind of a lymphatic drain approach in general, but it's your palpation for connective tissue bind, or where it needs to slide a little bit better, and then you can just switch the intensity and move into the bind, in and out of that bind, and now it becomes a myofascial technique. So if we're going to target this tissue, then we need to know about this tissue. And we're looking primarily at the fascia here, which is a type of connective tissue. And it does have a fluid component to it, but it tends to form in sheets. And then, embedded in this gelatin-like stuff, kind of, I now realize it's in an interstitium bubble wrap thing with interconnected tubes. There are fibers, and the ratio of these fibers and the types of these fibers to the more fluid part of it gives you the stiffness. So blood is a form of connective tissue, but it's not fascia. But those same elements come together with more elastin and more collagen and how it's aligned, and then you'll get a fascial sheath out of it. So the mechanical force is a big player in fascia. Also the nervous system, because the fascia has a tone. But this is the area where it's really the force itself that is causing a change in the tissue, and it acts locally, but then it can generalize through mechanotransduction. Also, the sensory receptors and nerves, fascia is highly innervated. So you've got to pay attention to the stimulus response as well. You will get asked some questions about this content on the MBLEX exam. And then what dysfunctions can occur and why, and what we can do. And so a lot of this is consolidated in what's called myofascial approaches. Maybe. All right. So been around a long time. This is not unique and it's not new. So this is how we modify the general massage approach. Here's some proficiency exercises to help you get a sense of the touch of it, the feel of it. And then tissue movement methods to work with the densification. This is working more initially with how thick the fluid is, and that can be altered. Now, if this densification continues, then you're gonna, the fibers that are in the fluid are gonna mesh, and they're gonna mat, and then now that's fibrosis. It gets fibrotic. But this is what you do, and easily incorporate it into the general massage. This is another modification. Transverse friction massage can be used in a small area, and you can also the scraping instruments can be used here, because the goal is to create a very small, controlled inflammatory response in an isolated dysfunction area where the tissues have gotten more fibrotic. And what you do there is to try to get a reorganization and a remodeling of the tissue, which is triggered by acute inflammation. And so if we can create a very small response, and this would be an area where the tissue might be a little tender to the touch for a couple of days. Remember, this is very focused, and the person moves that area rhythmically, through a healing response. So now we got an acute injury, and it goes through that healing response. We hope that they will get a reorganization and a remodeling of the connective tissue in that area. A group of wonderful people and physicians and physical therapists and researchers, the Stecco family, has formalized this into something called the fascial manipulation method. And, you may want to explore that as an avenue of future study. So here is your methods of frictioning, following those principles, and then how this is organized into a protocol. So the idea of direct and indirect, ease and bind, if you're moving into the stiffness, the stuckness, that is your direct method, that is the bind. If you're moving away from that to where it moves more easy, is less tender, that would be ease. In the muscle energy concept, positional release is an indirect method. Stretching is a direct method. So that idea of direct and indirect, ease and bind, is an important concept for us to understand when we're developing our approaches. And my mentors, Dr. Chadow, Dr. Girovich, and others, their premise was to work as generally and gently as you can first, and then get more specific. So least invasive first, and working with the ease and moving back and forth between ease and bind is a less invasive than direct pressure, aggressive stretching, and frictioning methods. Okay, here we go. And then we're going to bring in the concept of trigger point intervention. There is research controversy and opinion controversy over this, but I think it is a beneficial concept to help frame your assessment and intervention. So that's all talked about here, as well as in this mentoring tip. And we sort of kind of don't really know. So it's it's an educated guess, it's a theory. And there's a tremendous amount of overlap between the physical location of trigger points, acupuncture points, marmas, which are points in the more Ayurvedic concepts. There seems to be a physical location of what's called a neurovascular bundle. So it's a perforating vessel that comes up off of main vessels towards the surface, that has the combination of a nerve, which has both sensory and motor components, a lymph collector, a arterial, a little tiny artery, and a venule, a little tiny vein. And and it interfaces right there in a very small localized area. When they have when you apply compressive force on these, they have a peculiar nervy type sensation. So here's how they think this trigger point phenomenon might form. I was very fortunate enough to have had Dr. Chadow as my teacher, mentor, and friend for many, many years. So, I respectfully pass this information on. So this is the classic representation of referred pain patterns. And in the appendix B, the quick muscle guide, it gives you the muscle, it gives you the action, and then it gives you the typical referred pain pattern. This is the visual of that. So I will often give this figure to people and I would say, okay, pick it out. What looks familiar here? And then that narrows down where I'm going to be looking for these hyper irritable spots. And I can also use drag palpation, these where the actual focal location is usually a little sweaty. And so both of those help narrow down on this. And the main intervention is a broad-based compression that is going to squeeze the fluid out around the area, and then you're going to add movement. Sometimes that's called active release, or it's got other names to it, but we teach you it as inhibitory pressure plus movement. So this goes into how you can palpate for these areas. And Janet Travell was one of the first. She was a physician, and she wrote books, Travell and Simons. They're a valuable resource. There are some other authors that have looked at created newer editions of this content, and kind of tried to make the research a little bit more current. But as far as a conceptual understanding and practical application, the Travell books are expensive, but the Travell books are helpful. They got great visuals, as well as the additional resource material that Dr. Chadow has done. And he and I actually wrote a book about this together that focuses right on this with other health professionals. So the recommendations for treatment here come from that base. And then just because it's painful to the touch doesn't mean it's a trigger point. You press hard over any neural structure, it's going to create a sensation. So, you might be just poking them. But it has to recreate the symptom that the person is experiencing. That's how you would choose what you would narrow down and focus on. So there is an area, it gives you a treatment sequence here. It looks like, as I am seeing this, we might have a figure in the wrong space, but that's okay. Stuff happens. And we do have some really good proficiency exercises here. So neuromuscular therapy kind of is the terminology that's used that combines some connective tissue principles and some trigger point principles, and maybe some muscle energy technique and joint movement. This is the conglomeration of it. And then we get into our Asian bodywork methods, and only offering an overview here. As far as the MBLEX is concerned, general language, just the general language. You would want to know that acupuncture is part of the traditional Chinese medicine system, and you might want to have a general idea of what yin and yang is, and how we would isolate in terms of using some meridians, and how we can incorporate those locations with the massage. And you don't have to know this specifically, but it's nice to know. Your clients may be experiencing maybe they're seeing an acupuncturist or a traditional Chinese medicine practitioner, and having a general idea will help you understand the thought process of what that professional is doing. So this is just an overview here of the meridian structure. And some of the language, but you don't have to encounter this specifically. This is not going to show up specifically on the NBLEX exam. All right. And then an overview into the idea of shiatsu and Thai massage and into some color and chakra therapy. So as I am looking through this, I am seeing that we have some visual issues. Some of the figures here are not where they're supposed to be. So we'll see if that can be corrected. If not, it's okay. All right. And then here we're going to get into the more energetic approaches and the biological plausibility, and how that might interface with some of the properties of connective tissue. And we're going to focus in on polarity therapy. There is an actual certification process, continuing education base for polarity therapy. So we're going to highlight that. And again, I'm seeing problems with the visuals here. So I'm going to have to get with my editors on that and see what happens. Fortunately, when we get down to our foot massage and reflexology protocol, this is appropriate. So there we go. And this is a summary on how all of this can come together and how you would double check me on my referencing if you want to do that, and the end of chapter questions. Ta-da! And here we go. It's coming. It's coming. Lots of research here. All right. And at the very end of all of this, we will get to the multiple choice questions for discussion and review. Ta-da! All right. This chapter gave you a general overview. In class, we will practice some of this, and it also gives you a little bit of direction for future study.